Welcome to today's health discussion. Today, we are focusing on prostate cancer, which is recently the most commonly diagnosed cancer among Kenyan men. We will be joined by Dr. Catherine Nyongesa, a clinical consultant and radiation oncologist. She is going to help us understand what is prostate cancer, the benefits of early diagnosis, and what really happens if prostate cancer spreads to the bones. My name is Rose Samulevu.
Hello everyone, thank you so much for having me. My name is Dr. Catherine Nyongesa. I'm a consultant, clinical and radiation oncologist, a cancer specialist. I treat patients in Kenya. I also run the Texas Cancer Center.
In our today's episode or discussion, we want to discuss about prostate cancer. So what is prostate cancer?
Thank you so much for that question. Prostate cancer is one of the public health problems in Kenya, and it is a cancer that arises from the prostate. A prostate gland is only found in men. It is a small gland just behind the urinary bladder in the pelvic area, and inside this prostate, the cells start growing abnormally, multiplying, and they can form a tumor, and that tumor is what we refer to as prostate cancer.
How common is prostate cancer in Kenya?
From reports that have been published by the National Cancer Institute and also from Globacan 2024, it shows that in a year we see about 3,601 new prostate cancer cases. Unfortunately, about 2,199 succumb to the disease. This could be an underestimation because many patients with prostate cancer never reach hospital, or some may never be diagnosed, or they are treated for other ailments without knowing.
Which men are at greater risk?
So age is the greatest risk factor for prostate cancer. We see it more in men who are above 50 years. And also it can run in families. So there are some cancer-causing genes in families. We call them BRCA mutations, which can also predispose people to families to prostate cancer. Use of tobacco and alcohol can also be one of the risk factors, but mainly it is age. As men grow older, the chances of getting prostate cancer are higher.
What warning signs should men look for?
As men age, the prostate enlarges, and this enlargement we call benign prostate hypertrophy, which may not actually be cancer. But there are some, if those cells grow abnormally to become cancer, then we call it prostate cancer. Now, the warning signs for prostate cancer, when it is in early stages, you may never know. It doesn't show any signs. However, as it progresses, the signs are similar to what we see with the benign prostate hypertrophy. For example, poor urine stream, dribbling, they may have pain on urination, blood in the semen, erectile dysfunction, and if it spreads outside the prostate, then it can go to distant sites, to other organs. The common organ that is affected is the bones, and with the bones, patients will feel a lot of pain. And these bones can crack or even fracture or break into pieces, and that causes even more severe pain. The commonest sites that this prostate cancer spreads to, it's to the pelvic bone, the spinal area, and those are the main areas that it spreads to, so it can spread to other parts of the body.
Should every man have a prostate cancer test?
Not really. We don't recommend. There are various schools of thought. There are those who say that men should go for routine screening. Others, they don't recommend mass screening. However, a man who is above 50 and has no family history of prostate cancer should discuss with his doctor about the need of screening. Men who have symptoms also need to be checked. However, if you have a strong family history of prostate cancer, then your screening can start earlier, like from age of 40, 45. We have various screening tests. These include blood test, we call it prostate specific antigen or PSA. We also can do scanning, MRI to check, and also the doctor has to examine you. So it involves multiple things. However, a high PSA alone does not mean you have prostate cancer. And a low PSA alone also does not exclude prostate cancer. It is always good that one sees the doctor, the urologist, who will go through, examine the client, and advise if we need to progress for further tests to identify prostate cancer.
Mm-hmm. How is prostate cancer confirmed and staged?
So we confirm the prostate cancer through multiple tests and also from history and physical examination. So once you reach the doctor, they will question you, ask, how are you feeling? How long have these symptoms been going? And then from there, they progress to examination. The doctor may have to put a finger into the back passage gently to ensure they want to check the size of the prostate. They'll also run a couple of tests, including PSA, MRI, ultrasound. And if the doctor suspects that this cancer has spread, other tests, including a PET scan, may have to be performed. Obviously, to confirm that one has prostate cancer, you will need to do a biopsy of the prostate gland. They go and check in the microscope in the laboratory. The pathologist will check to confirm if indeed those cells they are seeing under the microscope are cancerous.
What complications can occur when prostate cancer reaches the bones?
So the complications can be, depends on the location. One, it could just be pressure symptoms. Maybe they form a tumor which can press on nearby structures and cause pain or obstruction. Another complication is that these cancer cells, they weaken the bones, so the bones can break. And for example, if it's in the spinal cord, the spinal vertebral body, if they crack or crash, then a patient can become bedridden or paralyzed, get weakness of the legs and may not walk. And they lose control of the urine and can lose control of the stool. Sometimes also this cancer in the bones, wherever they are, they'll cause pain, and patients really get stressed due to this pain.
Can a prostate cancer that has spread to the bones be treated?
Yes. The goal of care is to find prostate cancer when it's still in early stages and the chances of cure are high. However, as we said, prostate is a silent disease in most men. In other men, it grows very slowly inside the prostate and they live with it with never knowing they had prostate cancer, and it never disturbs them. Unfortunately, there are some types of prostate cancer that grows very aggressively, and once it starts causing symptoms, it's good for this person to be treated. There are various forms of treatment. We can use hormonal therapy. These are hormones because it has been known that there's a hormone in the male hormone, actually the testosterone, stimulates the growth of the prostate cancer cells. So how do we manage this? By giving hormonal therapy. It can be medical, where we give injections or tablets. You can also do surgically. How do you do surgically? By castration. Okay, there's a verse in the Bible that says men who are castrated will never see the kingdom of heaven. This is a myth. The truth is that castration can save a patient who has prostate cancer. It's a form of hormonal treatment. We also have other medications, we call them chemotherapy, that can be added for the patient with metastatic prostate cancer. Radiation therapy can also be used to manage pain. Where there's a fracture, it can also support to reduce the pain. It's a multidisciplinary care. Sometimes we have to involve the orthopedic surgeons to fix broken bones. If it is a weight-bearing bone amenable to fixation. We also have newer treatments on the market. We call them theranostics, where they give special form of targeted radiation. in form of an injection, and this targeted radiation goes through the blood and goes to deposit where the cancer cells are and can also help reduce the burden. We also have what we call biphosphonates. These are bone strengthening agents to strengthen the bones so that they are not weak, and if they are weak, bones are weak and break and cause even more debilitating symptoms to the patient. So what I would say is, if you have a man, an elderly man, or any man above 50 complaining of those urinary symptoms and has back pain, it could be a warning sign that they could be having prostate cancer. However, majority of the time, it could be that it's just arthritis because of the age. The only way to find out is to see a doctor so that this cancer does not compromise the integrity of the spinal cord. Ultimately, this person may be paralyzed and be wheelchair bound if treatment is not initiated in a timely manner.
Why is spinal cord compression so important?
Spinal cord compression is so important because, you know, our nerves, it's like the nerve center of mobility. So if the spine is affected, the spinal cord is affected, then there's a chance that you have weakness of the legs, the hands, and ultimately you can become paralyzed and immobile. So you can't walk, you need wheelchair. So it's one of the debilitating complications of spinal metastasis from prostate cancer.
What particular challenges do patients face?
There are multiple. One is not knowing that the symptoms they're having could be prostate cancer. Others not knowing where to go for screening. Others could be financial, because screening, going for treatment is expensive. Another challenge is more physical, like a physical barrier. You may want to go for screening or for treatment, yes, but you are in a remote county and the hospital nearby you doesn't have those kind of services. And the other one is just about literacy, just lack of awareness. Others, they have psychosocial issues, you know, the stress that comes with cancer. For example, they have erectile dysfunction. They may have weak backbones, pain in the bones, difficulties in urination, and sometimes even the urine can totally block, like you can't pee. So it means the doctor has to put a catheter just in the bladder around the pubic area, just above the pubic area, and sometimes putting a catheter through the private parts. And really patients get so much distressed with walking around with catheters. You know, they have families, so it is not an easy thing. Sometimes now the dribbling, the leaking of urine, is also stressful to them. However, if diagnosed early, this can all be managed. And as I said, the care is multidisciplinary. So all those complications I've talked about, there is hope. So it is just a matter of visiting your doctor and they devise the best way possible to manage the situation.
What is your advice to the patients who have turned to herbal or other alternative treatment?
As a doctor, I would recommend a patient to go seek professional advice from a medical doctor and a hospital. Go to the county referral. See consultants, a urologist, so that when you go herbal, you may waste so much time and the window of cure may narrow down if you continue taking those herbs without consulting your specialist. Because from the research that is being done worldwide, it shows that prostate cancer is manageable. It can be cured when diagnosed early. When it's late, the medication can help to slow down the progression and improve the quality of life of the patient.
Thank you so much, Dr. What is your parting shot?
To me, I would say, if you like this video, please subscribe and like it. Also, if you have a loved one suffering from prostate cancer, hold their hands, support them, because it is not an infectious disease. Also, if you have a family, a friend who want to know more about prostate cancer, please share the link so that they can watch this video and learn more. And feel free to send a message through our inbox if you want to learn more about prostate cancer and any other cancers. I've been your doctor, Dr. Catherine Nyongesa, and thank you so much for watching. May the Lord bless you, and may the Lord bless all those who are going through this treatment. It is a difficult time, and if you have a loved one who has prostate cancer that has gone to the bones, do not give up hope. Continue taking him to hospital. Let him get the treatment that is desired. And if you have anyone you want for screening, please feel free to take them to the nearest healthcare facility for screening. They'll have a discussion with the doctor, and the doctor will advise whether they are eligible for prostate cancer screening or not. Thank you and bye.
Don't forget to subscribe, like this video, and share it with your friends and family. Together, let's tell stories that make a difference.